guys believe me if I told you 67% of doctors think marijuana should be a medical option for patients? Probably not, but it's true. And don't we all tend to agree with doctors' opinions? With this being said, the legalization of medicinal marijuana would benefit our nation tremendously. However, there are people that focus on the health risk and also how it can be addictive and a gateway drug. But another big question is, how big of a medical value does it even have for us? So first I would like to start off by talking about the health risk. One health risk, and I talked about it last time, was how it kills brain cells. The government also says how it can lower our IQ. And they have proven this by using the monkey test done by Dr. Heath in 1974. So there, it just kind of shows this test is a little out of date and probably more research needs done on this topic. But in his study, he used monkeys, put gas mask on the monkeys, and then put smoke into the gas mask, equivalent to 30 joints a day for 90 days. When he did this, he basically just suffocated the monkeys' brains in 3 to 5 minutes with oxygen deprivation can cause brain damage. So was it the marijuana that caused brain damage, or was it just the smoke suffocating the monkeys? And another big health risk is overdose, because people associate marijuana with drugs like heroin, meth, and cocaine. And unlike these, marijuana shows no sign of overdose, and there has been no reports of anyone ever dying by smoking marijuana. And to be able to overdose, I thought I just want to add this in here. You would have to smoke 1,500 pounds of marijuana in 15 minutes to be able to do that. I don't know how much you guys know, but that is a lot, and it's probably never going to be done. And the only way to really die is if someone laces the marijuana with another hard drug or whatnot. So making it legalized for patients would, in terms, help the safety of what people are consuming when using the drug. And now the addictiveness and the gateway theory behind this. The government tells us how there's really no hardcore evidence on either of these, but they like to lead us in the direction that it can be and try to show examples. But because marijuana being illegal, this can lead to, say someone wants to go buy weed, they would have to go to a drug dealer's house. And when they go there, the drug dealer's probably selling other type of drugs, and they might try to get them to buy something else. If you have it legalized, you go to a dispensary, you have marijuana there, and that's it. No other drugs to choose from. So it would really help, like, people wouldn't have the option of those other drugs. And now the medical value behind it, I'm going to list some of the symptoms it can help with. And just think if you know anyone that's had any of these. Alzheimer's, anorexia, AIDS, arthritis, cancer, epilepsy, glaucoma, HIV, migraines, multiple sclerosis, nausea, and pain. And those are just some of the many symptoms that can be. As Dr. Lester Greenspoon, professor of psychiatry at Harvard University, said, doctors and nurses have seen for many patients marijuana is more useful and less toxic than the conventional medicines prescribed for diverse symptoms. So like just our regular pills that we take every day, some doctors believe that marijuana could be used just as effectively. And a solution to this issue, our country needs to hold a vote on the issue of medicinal marijuana, making it legalized. And one thing that needs to be done is we need to push for legalization and help people understand all the benefits and not just listen to all the negatives about marijuana. and taking the medical value into perspective, it should be a no-brainer to legalize marijuana for medicinal purposes.
Could people, like, if it was legalized and dispensaries were open, couldn't drug dealers just go to the dispensary, buy a bunch, and then sell it to people who don't wanna go to the dispensary?
Well, in my last speech, how I said about the medicinal cards, you have to go to your doctor first, and he prescribes the cards to you. You can't just go into the dispensary and buy them. You have to have a card to.
Exactly, like somebody, the drug dealer could just go, could have the card, go get a bunch, and then sell it to people that don't have the cards.
I mean, you can think of it like, there's ways to do illegal things with everything. I mean, that seems a lot of work. I don't know, they have to make it legalized to see if that will be a problem or not, I think, so.
They haven't done like any more tests
There's like, since it's like, it's classified as a heroin and whatnot, so there's no real test done in the United States about it, and I couldn't find any overseas tests.
So if they do legalize medicinal marijuana, how are law enforcement officers gonna know the difference between someone who's using it medically and someone who's using it
You'll have your
recreationally?
card,
But are
and,
they really gonna card everyone?
I mean, if you're caught with marijuana, you show your card, and if you don't have your card, then you go to jail, obviously. So, I think it could be legally regulated if you just have your card, just like a license or something you carry on you.
You said that 67% of doctors said that it was a good thing, but how many doctors did they ask?
I think it was out of 100. A survey out of 100.
You said that like it helps a whole bunch of different symptoms and like glaucoma and arthritis and all that stuff, but how does that like actually help you?
Right. So, say you're an AIDS patient or cancer or something, and you're having trouble eating, appetite-wise. People use marijuana to help them eat, or even they're having trouble sleeping at night, helps sleep. Just pain, it can help like take the focus away from the pain.
So you said 67% of doctors think it's okay. Is that because you think they're educated on what marijuana does, and like to the normal person, they're not really educated and they just hear marijuana and they think it's a bad thing?
That's correct. That's why because doctors, we tend to listen to doctors nowadays, because doctors usually know what they're talking about with health stuff, right? So, I mean, it probably just, good point to put out there. Yeah.
And it's like the medicinal marijuana, is it like a one-time thing, or the patients use it over and over and over?
It's something they would have to use until their problem's fixed, or if it's something like, there's people with multiple sclerosis, they will just have to use it every day, but it just helps tremendously, so there's really, I mean, just like any other medicine, you have to take it every day, usually. Canon?
How does the price if you like buy it on the street compare if you get it from like a doctor? Like,
Well,
looking
if
at
you
that.
go to your, I mean, I don't really know, but if you go to your doctor and stuff, I feel like you'll get maybe a break or a discount or something. I don't know. It's not like that. It's hard to.
If they legalize it for medical purposes, do you think that would lead towards legal or just?
I mean, it possibly could. It just would have to. I mean, I kind of think they might be seeing how it goes in some of the states and then waiting to push forward in others.
If it's like legalized for like medical purposes, do you think there's an age limit?
Yeah.
Like
Yes.
little kids?
With that, there are little kids that use marijuana for medicine, but it just all depends on the symptom, how bad it is, and how easily it can be treated with marijuana.
Sorry, so you like dosage too.
Correct.
One final question for you today.
Yeah.
Do you know anything about how they're actually issued? Is it just doctor judgment? So if I go to my family doctor and we're best friends, can
Right.
he give me a medicinal marijuana card and I'm good to go, or is it like pretty regulated?
It's, I mean, you can't just walk in there and be like, oh, I have a headache, I need a card. I mean, you have to probably show symptoms. I mean, the doctor's the one that decides, so it's a doctor's opinion, so.
All right, John.